So thank you so much for joining us here this afternoon. We are focusing on Street Child's COVID response in Sierra Leone. As I'm sure everyone on the line knows, while Street Child works in 14 countries around the world now, this work began in Sierra Leone. Sierra Leone remains, if not our largest, one of our very largest program countries, and particularly dear to all of our hearts. We're joined by Kelfa Kagbo. Kelfa is the Executive Director of Street Child. We're joined by Sia. Sia is the Programs Director and heads a lot of the urban work, and she'll be speaking to that perspective. And we're joined by JMK, who is in McKinney, and JM has headed all of our rural work now for almost 10 years. I'm now going to hand over to Kelfa. Each of the presenters is going to talk for just 5 minutes initially to set the frame of the COVID situation in Sierra Leone and the early response that Street Child has been mounting. And then at the end of that initial 15 minutes, we'll open to a more fluid question and answer session. The way you ask questions is just to type into the chat. I think we are all now very used to webinars, even if we weren't 5 or 6 weeks ago. So yeah, just type your questions into the chat, and I will direct them to the person who's best placed to answer them. And as we go, I may share a couple of my own thoughts and views as well. Right now, I'm going to pass to Kelfa Kagbo. Kelfa is the Executive Director of Street Child of Sierra Leone. Kelfa, thank you so much for joining us.
I'm very happy that we could all come together to talk about what Street Child is doing in Sierra Leone as a response to COVID-19. Some of you may have come to visited Sierra Leone when Sierra Leone was in a better position, when Sierra Leone was not ravaged by COVID-19, or shortly some of you after the Ebola crisis. Sierra Leone is one of the countries, well, I could say it's the last country in West Africa on the 31st of March that recorded its first case of COVID-19. It was an international traveler from Europe who came, and while in quarantine for 14 days, on the last day he was discharged to go home and join his family, but he objected that he's experiencing some signs that he wants to be tested more. And this guy was tested, and finally it was proven that he was COVID-19 positive. That was on the 31st of March. And 2 days later, we had our second case. And then going forward from that level, from the 31st of March to today, we have recorded 231 positive cases. Those who recovered are just 54 recovered, and then 16 deaths that we have recorded over COVID-19. And currently, we have 8 districts out of 16 districts that have been affected by COVID-19. And so we've moved from the level for the last 1 week, we've moved from transmission that are with primary contact to community level transmission. And that has become very, very worrisome for not only Street Child, but also for everyone living in Sierra Leone. But however, Sierra Leone, we're better placed because we're just coming from fighting the Ebola, which in a way is similar to fighting COVID-19. And one thing we learned during the Ebola response was the way we were ahead of the spread of the virus. And one big thing we did was to do community engagement. using teachers that we are working with, that we have been that we are supporting in schools to be educators within communities. And I can tell you, most of the communities we work in, about 95% to 98% of the communities we had teachers recorded 0 Ebola cases. And that's the system. When we were faced with this challenge, we were asking ourselves, how best can we work? How best can we support in the fight of COVID-19? And so our biggest thought was, can we do what we did during the Ebola crisis? Can we scale that up? Can we make it more bigger? So Streetchild as an organization, we are constantly working, trying to link up with the government, trying to link up with bigger organizations like WFP and other big ones, so that we can team up and see what we can do. Because Sierra Leone's biggest problem we have, this is the planting season in the country. And not only is the planting season, this is the time that most of the children transiting from primary school to secondary school should be preparing for their exams. And this is the time where those in junior secondary school are also preparing for their exams to transit into senior secondary school. All of these things are major, major challenges that have been brought to a standstill. So we're not only dealing with the current problem, but Streetchild, we're now focusing on what can we do to better place us to address the issues rather than wait until we are faced with a major problem. Currently, that's the problem now we have in Sierra Leone.
Calvin, thank you for those framing comments. We now pass to Sia. Sia, please tell us about the situation in Freetown and the work in the urban areas.
Hello, everyone. So in Freetown, always like I mentioned, Sierra Leone has recorded 231 confirmed cases of coronavirus, positive cases. And out of that 231, 152 cases, which makes 70%, are from Western area urban. That is mainly Freetown, where we are the headquarters of the capital of Sierra Leone. And Western area rural, which is just around the outskirts of Freetown, recorded the second highest cases, which is 29 confirmed cases, and also makes 12%. So in all, about 82% of the confirmed cases that we now have are in the Western area of Sierra Leone. So this has been of concern to us as Streetchild, because Freetown is a very crowded place compared to other parts of Sierra Leone. And there are fears that the virus might spread very quickly, especially among vulnerable and populated communities like Kube, like Wazak, the Bomedon side, Waterloo, and other places where we have been working together with our partners. So also, unlike Ebola, whereby people can actually see and know those people who are sick of Ebola, because they will definitely fall ill and might display some other symptoms like vomiting, etc. It is not the case with corona, we all know, because there are people who may get the virus and they're not sick at all and they do not show any symptoms. Yes, exactly. So it's a concern for us, especially so again when people do not seem to understand or practice what is social distancing. So you go to town, you see people crowded in the market areas, in the major streets where trading is taking place, you see people crowded, even at the banks where you feel people who are educated and more enlightened are visited. There is absolutely no social distancing in practice. So as Streetchild, this has been of concern, and what we have been doing mainly is first of all to raise awareness. We have been raising awareness not only in Western area, but also in the provinces in 12 other urban towns and in rural communities. And the awareness we are raising is first of all to let people understand that indeed coronavirus exists, and it is also present in Sierra Leone, because there are doubts that, oh no, coronavirus, it does not seem as if it is in Sierra Leone. It's just like the government wants to do this and that. So we have to drive home that message that the virus is there and people are falling ill, and we have to take action. We are also explaining to people how this virus is transmitted and how it could be prevented. And one of the ways that we have been proposing and the ways we have been bringing out to the public is frequent washing of hands. We have been doing that, sending across the messages, and also as a second intervention, ensuring that we practicalize what we are telling them by bringing them hand washing stations in various strategic locations across the community, so that they do not give excuses to say, oh, like, we want to wash our hands, but there's no water, there's no soap, because people give all these excuses. So we back up the awareness raising with these messages. And in Western area, we have provided 120 hand washing stations and are still providing them. And then we are also providing 450 hand washing stations across the rural communities where we are working. And in other urban towns, we are providing 165 hand washing stations. So all of these are things that are currently ongoing. We are backing them up with the messages. And another thing that we have done in Freetown and other urban towns is during the lockdown. Just for you to know that Sierra Leone have had 2 lockdowns, 3 days each. The first one was on the 5th to 7th of April, where the government announced this lockdown after we had recorded 4 cases. And it was mainly to trace contacts and isolate people and take them to hospitals. During those lockdowns, there were fears because we have 6 children who do not know where the next meal will be coming from. Street Child ensured that we provided hot meal packs for street children and other vulnerable groups. Like in the first lockdown, we provided 7,119 packs of hot meals across Freetown and other locations for 3 days. And in the second lockdown, which was from the 3rd to 5th of May, we have provided 10,458 meal packs. And there is a story of a particular boy in Watalo, this boy that you see. This is a boy that goes on and off the streets. And on this particular time, he was on the streets and they announced the lockdown and he couldn't return to the village where he came back from. And he was sleeping on the marketplaces. He had no idea where he would get any meal for the 3 days. And then, like a miracle or like a dream, Street Child appeared with these packs of food. The boy could not believe his eyes, and he was so happy. And every day, our social workers ensured that they located this boy and they provided food for him and a lot of other children. These are things that we as Street Child plan to do because the government has again informed us that lockdowns like this will be happening every now and then as long as we continue to have feeding. But how do we continue to do this feeding? We need the support. There is need for us to increase the number of packages that we are providing as there are more people that need this food. And we also want to intensify on the awareness raising in the community. So far, these are the things we are doing in our urban community.
Thank you so much, Thea. That was fantastic. JMK, your presentation on rural begins now. Please, thank you.
Hello, everyone. It's a pleasure to be on this panel and to share with you what actually is happening in rural areas where I work with respect to COVID-19. The situation in McKinney and beyond is actually one wherein knowledge on COVID-19 is actually minimal. People in the villages, they know very, very little about COVID-19. Probably all what they know is that there is a disease outbreak in the wider world and it has caused a lot of death. Probably just that. And all they could do is, if they have chance, if there's a visitor, they could ask you what is happening with this disease, what should we do, and things like that. So generally, you see that apart from the big towns in the provinces, like we have Makeni or like Kenema, where some COVID-19 cases have been recorded, where you literally see people around, some people around with face mask on. But if you go to the villages, no, you will not see any face mask. If you see any face mask, there is a visitor who has come from the city and is trying to go back. But generally, people have very, very little knowledge on COVID-19. And we are afraid if this disease should get into their midst without any knowledge on how to prevent themselves, then of course we are afraid that the effects could be as devastating or even worse than Ebola. And many, as an organization, we have been doing our own little for over a month now to actually get these communities sensitized on COVID-19. We have been able to train our teachers in those schools that we have been supporting, teachers that we have been working with over a very long time. These are the teachers who have been able to provide basic training on COVID-19 prevention and precautionary things, so that they're able to go back to their communities and train them and raise awareness on COVID-19. And this has been going for nearly a month, ongoing for nearly a month now. And you see, like, it's bringing a big relief back to the people, in as much as they get somebody they trust. Using teachers as a means to spread messages in rural communities is really, really important, because these are the people this community trusts so much as far as information sharing is concerned. They believe that what the teacher says is just gospel truth. They believe that whatever message the teacher comes with is true, and they will do all their best to abide by it. So at the moment, we have got up to 150 teachers who are actually training or who are actually spreading COVID-19 messages in 150 villages. And the good part is you will see many of these people are responding to the teachings that they are getting from these teachers. They are actually trying to practice some social distancing. They are trying to practice frequent hand washing with water, and some who could afford it with soap. Yes, and we are really trying to do our best to see how we can engage them further to do thorough hand washing with soap and water, because that is what actually will solve the problem better. And again, in these communities, people have had a lot of experience with Ebola before. And so it's like when the teachers go around and talk to them about COVID-19, they do draw a lot of similarities, and they believe that for sure they can, like they did in Ebola, they can actually prevent or curtail the spread of COVID-19 if only they all come together and they follow the precautions together. Schools have been closed in Sierra Leone, like in many other places, and for over a month now, our children cannot learn. Learning has been one of the biggest things that has been hit right across Sierra Leone. And we live in a world where internet is really, really poor. Like I was the last to join this call because I'm really talking from Makeni, where internet has not been very good for us for the last couple of days. And we have one of the best internet in the provincial areas. So I cannot talk about the villages, the other smaller towns, where the problem is so huge. Learning is not really taking place. Schools don't have the facility to conduct distance learning or e-learning, like maybe you would have in other developed parts of the world. And so, from the day schools were closed, like learning was literally closed in many homes and in the lives of many children. And all what they have been doing now is either going to the farms, going to the forest, or whatever, playing around in the villages, because there is no way that learning could be provided to them without getting them into the four corners of the classroom. So as an organization, we have actually designed what we call a last mile learning. That is about taking learning to the outskirts, to the last miles of the world, the outpost, where civilization, I would say, where modernization is completely lacking. There is hardly anything like phone signals. Internet is completely lacking. Those are the areas, those are the communities we actually want to pilot this e-learning program that we want to introduce. It's actually about recording lessons. We want to record lessons in memory devices and then get them into simple SD card players, take them into these rural communities, and then get teachers to organize maybe children in groups of, say, 4, 5, or 6. They learn and then give opportunities to other groups. We are really trying to see how more children we can reach with the little resources we have at the moment. But we really believe in this, that it could work. Taking these players, these SD card players into these communities with recorded lessons in them. Would have our teachers as learning coach. They will be there to facilitate this learning, and in the process, we'll definitely make sure that social distancing is actually observed very strictly, and to make sure that children really stay safe. The safety of the children is really paramount as we plan and organize all of this work that we are doing. At the moment, we are about to start a very small pilot that will look at basically something like 20 communities targeting up to 600 children with e-learning, and to see what we can learn from this and how we can take it forward. So basically, we are really concerned that COVID-19 messages must be taken to these communities to get them prepared. It's a way of heightening preparedness, or else if COVID-19 should knock at their door when they are not prepared, definitely it will cut them aback, and it will cause a whole lot of problems, more than we can imagine, in those communities where the facilities are completely lacking. Those are communities where health facilities are just completely lacking. So if we allow the disease to get into those communities, then definitely it could have far-reaching effects, more than we can imagine. So it's really good that we act now to really build a fence around them, a fence of protection around them. Thank you very much.
JM, thank you so much for this news from McKinney. I'd now like to really encourage questions. I'm hoping they're going to pop up on the right-hand side of my computer, and then we'll throw them to whichever of the panelists makes the most sense. Whilst we come with questions, if I just kind of sort of reflect, sort of personally, really, back to Ebola. Again, many points one could draw on, but in particular, JMK and Kelfer and I went up to a village called Pondu, which was the village where Ebola began inside Sierra Leone. It began across the border in Guinea. And I remember the chief of the surrounding area, the Kisiteng sub-chiefdom, who was with us for that morning, and just his kind of lament that why did no one tell us what Ebola was, how to transmit it, and some of you have heard me say this before, but really, I wrote about it on one of our blogs. But that message that I heard that day, and then the experience of moving around Sierra Leone in those times, and just even 3-4 months into Ebola, realizing that vast tracts of the population didn't know what Ebola was, didn't know how to avoid it. I remember being in a village just outside Lungi, where the airport is, and people said to me, "Have you got when is the Ebola medicine available?" And I just said, "Well, the Ebola medicine is just knowing to stay away from ill people and dead people." But I just think there's so much we can do to sort of honor the memories of what went wrong in Ebola by really making sure we take the messages to the furthest places. We've heard from SIA that the case numbers are not yet really high in Sierra Leone. They're really low compared to the numbers we've heard in Europe. But I think the key fact for us to really focus on is that Sierra Leone is still posting most days its highest daily rise, so we can see the climb. These are some of the thoughts for me. We do have a couple of questions now coming in. Sia, perhaps you could answer this one about the lockdowns, and perhaps, generally, but especially the lockdowns. Does SCOSL have to request special permission to go into the streets to hand out food? What are the modalities around that?
Yes, we do have to request special permission. But the good thing is that we are working in close collaboration with the Ministry of Social Welfare and also the Ministry of Children and Gender Affairs. So we are like their key partner in supporting the work of providing food to these children and other vulnerable communities. And so because of our close partnership with the government, it is very easy. They give passes to our vehicles, and then the team members in the vehicles, definitely in child t-shirts, are allowed to go through during the lockdown. And they also see the importance of the work we are doing, because there have been cases also where we have children who we are, arrested from the streets by security forces because they say they are out and they are breaking the law, they are not abiding with the lockdown. So Street Child has also been intervening and advocating on their behalf. So everyone now understands and values the work of Street Child even more. So it's because they know why we are out and what we are doing, providing food to the most vulnerable people, especially these children. We get these passes, which our team members used to go out during the lockdown.
Thanks, Sia. Kalfa, perhaps you could tell us a little bit about Street Child's wider partner network in Sierra Leone, in Freetown in particular, and how we're drawing on them as well as our around the country.
We're doing so well with our traditional partners and currently cultivating new partners, because what we do, we believe together we work as a team, we can reach a larger population than we are. And people like Future for Children, We Own Children's Foundation, Codwella, they've been our traditional partners and we've been working with them a lot. And like during the last lockdown, just to emphasize on the respect that Street Child has earned in recent days, it's the call I got on Saturday from WFP asking us that, can we do something? Street Child, what can you do? We are ready to work with you so that you can reach out to more people. And as I said, said, that in the area of obtaining passes, it's very, very strict. But the Ministry of Gender and the Ministry of Social Welfare, they decided that, you know what, because we value your work, you go ahead and do your preparation. We will do the application. We'll fight for you until you get. We're among the very few organizations that were allowed outside to work.
No, that's great. So on Saturday evening, you had the United Nations World Food Programme phoning you up, asking if they give you food to distribute, because they knew that Street Child had the permissions and the accreditation and the respect of the ministry.
Yes.
That's a powerful story as to the esteem that that SCOSL has held, and that's fantastic.
Thank you.
Yeah, maybe towards the rural area now. JM, extent are radio, local media outlets used to help sensitize people in rural areas is another question. And then another question is around, are there lots of checkpoints around regulating people, and particularly into areas? I certainly remember in the days of Ebola, we could hardly move a few meters down a tarred road without having to stop for another checkpoint and have our taken or whatever it was. Are we in that situation yet?
Yes. Let me come in because I'm really out here in the field. There have been lots of checkpoints that have been mounted to ensure to restrict inter-district movement, and even during lockdowns, we have this kind of checkpoints. And for us to move from one district to another, we have to request for a pass. At the moment, the coordinating body for the fight against COVID-19 is actually issuing what we call electronic passes. You have to apply, as somebody in the organization applies, apply for your name and your vehicle number and all details, and they also indicate which areas you would like to travel, and then after some days, they get back to you with the pass, and that is actually what is helping us. Like for myself, I have a pass, and my car has a pass, and that is making it easier for me to move around, to go to Kabbalah, to go to Connaught, to go to Kenema, and or to go to Lonsard, Masimra, where I'm currently doing a project. This pass is making it easier for us to move around. And the good part is, even the officers manning the checkpoints, they have high respect for Street Child. As soon as they say Street Child card, they say, oh yeah, they see people are doing very good work in fight against COVID-19. They just compliment us, and then they say, oh, you can go, you can go. Yes, they say we know exactly what you guys are doing. Yes, but for any other person without a pass, definitely you will not be allowed to pass, because the officers are strictly manning these checkpoints, and they will not allow any person who is coming from another district to move into another district without the necessary pass. And I think it's really a good way to help control the spread. I think it's difficult for people. A lot of people are finding it difficult. A lot of transport operators, they are now out of job and things like that. It's difficult for them. But then when you look at the nature of the spread, it's but in the best interest in the fight against COVID-19 to really keep all these checkpoints and these kind of checkpoints all over the place.
John, do we have any sense of how long the ban on, well, how long the schools will stay closed for?
Definitely, from my own end, we have no idea. We don't know for how long this will last, because the numbers, the cases of COVID-19 keep increasing, and once the cases keep increasing, then there is no way the government could relax the restrictions. And I think one of the reasons why children are not going to school is actually to restrict the spread of the disease from home to school communities and things like that. And so we are still worried at the moment. We don't know exactly when children will go back to school. We don't really know.
No, got it. And this is for whoever wants to kind of come in, really, where it's Cal for us.
Yes. Mm-hmm.
But to what extent are conspiracy theories or rumors or misinformation contributing towards the situation in Sierra Leone with COVID now? And look, I can think back again to Ebola. I remember again traveling with John in South Sierra Leone in July 2014, so just when Ebola was starting to get known, but no one really knew much about it. And arriving in villages, everyone was, normally people come towards a car, but actually everyone ran away because a rumor had come that white doctors were coming to take people away. White doctors the white man was coming to inject people with the Ebola this or whatever. There was crazy stories going around. Yeah, so at this stage where these type of things are going around and causing confusion?
Yes, there's so many conspiracy theories going around, from issues of, like, the clinics. Most of the clinics are empty, apart from people who are sick of COVID-19. Everywhere you go, they tell us, in the clinic, the doctors are there, they've come with a new syringe with a vaccine, and that vaccine is not to cure, but to cause the COVID-19. That's one conspiracy. And so people are, instead of taking their sick ones to the hospital, they'll rather keep them home or go to native doctors. That's one thing that is actually undermining not only the fight on COVID-19, but also dealing and responding to other sicknesses across the country. Another conspiracy theory is that the government is making up these numbers. There is no one is sick of COVID-19 in Sierra Leone. And that's very, very unfortunate. Whether it's for political reasons or not, I don't know, but that's one conspiracy theory that is going on. And we only hope, we're only hoping that people will realize that this virus is real and they need to do something to really fight it. But the biggest challenge that we have now is when people in the provinces tell you, the new disease you have is just for Freetown. It has nothing to do with us. And that's a big fear. If that myth is not broken, when we start to go down to local transmission, then that would be a big issue. The spread would just be like that. Because for the past 1 week, all the confirmed cases have been around the 20s, which was never the case. All what we had before was just around 5 a day, 3 a day. But the whole of last week, we're just finding moving up to 20, 26, 27 a day, 21 a day. And then today we are down at 6 confirmed cases. But that's the biggest problem. We're not coming down, we're still going up, we're climbing up the ladder. And if people do not start to accept that COVID-19 is real, it will be an issue. And if I can just comment on the reputation that we have earned. Most of what the staff, John has already said it, but what the staffs are telling me, when do you get to a checkpoint with a street child T-shirt or with street child branded vehicle, they don't even check, because they don't even check your e-pass. They said, you guys are doing a marvelous job. All they will say, please keep up the job. you're one of the most respectable organizations in this fight of COVID-19.
That's great to hear. I'm conscious that we'll be moving towards the end of our time now. So what I want to do is ask the three of you, just really sort of straight down the barrel. What is the one thing that you're most concerned for us to try and scale up? And really just to be blunt about it, what do we really need more resources to be able to scale up? I know that we're able to do quite a lot already. We've been able to allocate resources to Sierra Leone from Street Child's COVID-19 appeal, as we have to most of the countries where Street Child is working. And of course, we've been able to re-nose some of the existing programs we've had, and this is what has created the resources we've had to get our response moving to some extent. But we know we need to scale up. I know from my private conversations with the three of you that we need to scale up certain areas. And just take 30 seconds each, please, and just say, this is what we think we need to most urgently do in your area. And after that, I'm happy to, there are a couple more detailed questions which I'm happy to return to. But I'm conscious that some people listening may need to move on. So I just wanted to be able to hear those clear messages if they haven't come out already. So Kelfer, I'll come to you first.
Okay. Yeah. The key thing I want us to do is to increase our campaign out in slum communities where others are not going, so that they become, for them to understand what it means by social distancing. So it's education around protecting themselves against COVID-19. Sorry, Tom, I didn't get you.
Yeah, and just educate people. What are the keys? How will we do that? What will be the steps we take?
One thing we could do is to increase the team to fight, to raise up awareness within communities. Having structures within these various, there are existing structures, there are local leaders, there are religious leaders, there are market women. How can we work with these market women? How can we provide education, and how can we support them to increase their level of hand wash and then maintaining social distancing?
Great, thank you. Sia.
Yeah, so one thing we are very concerned about is the fact that there are going to be more lockdowns. That's what we feel. As the numbers, the first lockdown was announced when we had only 4 cases, and then another one was announced around when we had about 90 to 100 cases, and now we are 200 plus. So with lockdowns, we are concerned about those children on the street. We had fed them twice, and every now, with each feeding, we see how important this is. The first lockdown was more prepared because people were more prepared, and we had so many organizations around because it was announced like 5 days before the lockdown. But this one just came in at the very last minute before a public holiday. So it took everyone by surprise. And when you go around the street, you would not see those other organizations that you saw the last time. It was mainly Street Child. And this is something that we want to do again, because we see how important it is, and we get the feedback of how it really rescued and supported those people who had no hope of any meal. So Street Child will want to continue to provide feeding for children and other vulnerable groups on the street during lockdown. This is something we would want to do, and we want to do more than we have done in the past 2 lockdowns. That is one thing. And also the use of face masks, like GMK and other others have mentioned, the use of face masks is limited in many communities. We want to produce, we educate people on how to use them, and we distribute them because some cannot even afford to buy. Thank you.
Thanks so much, Sia.
Yeah. As for me, it's very simple. At the moment, Street Child is working with over 450 teachers. And for COVID-19 awareness raising, we are using only 150 teachers. So you can see we have a big potential to scale up. And these are people with repetition in their villages. If we can just recruit more teachers and reach more communities with the COVID-19 message, I'm sure this will make the biggest impact in those rural communities to really keep them safe and to keep them at zero COVID-19 cases. To me, simply I will say, let's train more teachers to reach more communities with the COVID-19 prevention messages.
Yeah, and so much of COVID is just an echo of Ebola. And can we train more teachers? Can we train more teachers? I think is a message I heard in my ear continuously throughout the autumn of 2014 from you. And I think, what did we finally reach in January 2015? A stage where we had something like 1,500 trained teachers moving around. And so 150 might sound like a big number, like we're doing something, but actually we're just at 10% of the capacity that we could have if we're serious about getting out to as many of the remote communities as possible. Thank you so much. Those were super clear answers. I'm going to keep going until 5, so we've got 9 more minutes, and there are some more detailed questions that have come through. They're not all as serious as each other. And just here, this one is for Kelfer. The question is, just wondering if Kelfer is raising sponsorship by bleaching his beard blonde. If so, how can we donate?
Oh my God, age is telling on me. Not actually bleaching, but it's just age that is telling on me. But actually, if somebody can donate towards my gray beard, that would be very good, because that would mean if you donate, then we can reach more villages where COVID-19 is. And that's what we should think about doing. Let's save 10 stitches by doing one very significant move at the moment. Let's not wait until the virus hits the village communities where the means of testing will not be available. So let's see what we can do. Now the rural communities that are much more vulnerable are free at the moment. What can we do? So I wish I can donate my gray beard as a fundraising something to raise, to reach more villages.
No, that's good. That's a very good sign of commitment. There's a question which is always a complex one to discuss here, which is, we spoke about market traders, teachers. To what extent are the societies in, I guess, particularly the rural areas, potential venues or vectors that we can use for messaging? It may be a question for JM. There's also a kind of catch-all question on the rural areas here. Just trying to say, what is the most important thing? Education for health reasons, e-teaching, shortage of food, masks, buckets and soap. There are so many. I kind of feel like you've given a bit of a flavor, but Jay, we'll give you another chance.
Let me start from the very last question. I think the first thing is about keeping them safe. And when they are safe, they can do every other good thing. And keeping them safe is about giving them the right message to be able to prevent themselves. So I think first, taking the messages to them, educating them on how to stay safe I think that is paramount. And providing for them those things that they cannot provide for themselves adequately to stay safe. Like, for instance, we'll talk about hand washing. Many people don't really have soap, and neither can they afford things like alcohol to really wash and disinfect their hands properly. But we are able to provide them with soap at every hand washing point. Then, of course, they'll be able to wash their hands effectively and properly, and that will actually keep them safe. Of course, we know there is the issue of for the need for food, or whatever it may be. But at the moment, they are still carrying on their normal life. They are still able to go to their farms and work. For now, there's no restrictions around going to your farm. A family is free to go to their farm and work and then come back. And so, meaning they are able to do their daily livelihood to provide their own little resources to stay alive. Yes, but I really think the messages to keep them the messages to help them stay safe is paramount in the fight against COVID-19. And I think that's what we should take into the rural communities. Of course, we should also look at probably even empowering certain groups or societies that have existed in the rural communities. There are certain groups of people which they have established some time back, and if we are able to train some of those groups, their executives or whatever it is, and they in turn can be able to cascade training down to their members, that also could be an effective way of actually keeping people safe. I'm particularly keen about keeping people safe because out there is no means of curing them. There is no means of testing them. There is no means of providing any kind of medical service to them. So the best and sustainable thing we could do is to provide them with the messages that will keep them safe.
Oh, loud and clear. Actually, that ties into one of the questions that just came through, which is, again, I don't know who wants to take this, so kind of fastest on the buzzer. Are Street Child developing our own awareness-raising materials and messages, or are we relying on a ministry or the World Health Organization? Where is Street Child getting its guidance from there?
Yeah, generally the government is so much in charge of the messaging. This is a learning they're taking from the Ebola response, and they want to ensure that the messages that goes out are being centralized. So they've done a draft of the general messaging which they've shared with us. So all we need to do now is how do you roll out these messages? How do you explain them properly to communities? But they are pushing. And what we're doing as an organization at the moment is to gather so much learning from different countries, especially African countries. How are they doing their messaging? And see how we can adapt messages from the government to better communicate to specific target groups.
Thank you. Look, I think we're gonna pull this to a close now. It's 2 to 5. I'm going to give all three of you the last chance to say anything if you have anything left to say.
Yes, just to add to the issue of myths and conspiracies and things that are undermining our work, there are like 2 people who have tested positive and who had actually sent out audio messages doubting whether they are positive at all on social media. So those messages have gone out and they are creating negative impact on our work. But like GNK and Kelf has mentioned, the teachers that we use in this rural community are people who are trusted and they are held in so much high esteem that once they come in with messages, the people believe what they say and they act with them. So that is all the reason why we need to have people like teachers who are highly respected and placed in society to bring out these messages so that whatever is going around, they can easily calm them and lead them towards the right actions to take. Thank you.
Thank you, Sia. JM or Kel for a final word?
Yeah, I think my own final word is just an old adage, which is a stitch in time saves nine. And I think if we're able to reach out these communities now, then we'll save thousands of lives that stand the risk of being lost if COVID-19 should penetrate into those rural, remote communities.
Thank you.
And I want to leave everybody this words or story I had about a boy that we worked with in Johnstown, not too far from Freetown, whose parent died as a result of COVID-19. And their elder sister, who was then 14 years, became the breadwinner to two younger siblings. And recently, during the community sensitization, one of the boys who is now 12 spoke to one of our social workers, and his question to our social worker since then has left me thinking, and I want to leave you with the same question. The boy said to the social worker, will this virus also kill my elder sister? What would happen to us? Those who suffer from the Ebola are really concerned. And equally, all of us are very concerned. Some of them were left as as child-headed households, and they are worried about their elder brother or elder sister who has been providing for them. What can we do? How can we support so that this one who is remaining as the breadwinner survives and doesn't contract the virus? It's a question that is haunting me, and I want to leave you with that same question.
To be with us, everything you've shared, and everything that you and the teams are out there doing at the moment. And I personally learned a lot just this hour, and in the conversations that we had yesterday in the preparation for this. Back here in the UK, if you'd have said to us,
Thank you, bye-bye.
30,000 people would die, well, we would have had we're in this situation. We now know the power of this virus, and we have the opportunity to put that knowledge into action and do everything we can to prevent it becoming such a disaster again in Sierra Leone. That is our commitment to Street Child. It's come across so clearly. So, thank you so much, and we're with you, and look forward to speaking again soon. It's been great. Thanks very much.